Let's talk about this article published by the American Cancer Society looking at GLP-1s and reduction in cancer risk. Currently, GLP-1 medications are not approved for cancer risk reduction or prevention, meaning we should not be giving or prescribing GLP-1 medications for that reason alone. Let's quickly talk about how GLP-1 medications work. Our body makes a natural hormone called GLP-1, and what GLP-1 does is it slows digestion and controls blood sugar and tells our brain that we are full. And these GLP-1 medications are mimicking GLP-1 hormone and can help treat diabetes, manage insulin level, slow stomach emptying, control appetite and cravings, and help you feel full for longer, leading to weight loss. Now, we do have studies showing that GLP-1 medications can lower cancer risk. And so what are the ways by which that happens? And one of the ways is certainly weight loss, because we know that excess body weight is a risk factor for multiple types of cancer. But it's more than just weight loss. Some potential mechanisms that are being proposed that have some early signals that are being studied include reduction of inflammation from the GLP-1 medications, the impact on lowering insulin levels. And then the bottom one is very interesting, but can GLP-1 medications help our body's immune system become better at finding and destroying cancer cells before a full-blown tumor or cancer can develop? And that's very early, ongoing research, but certainly very, very exciting. And I think one of the things that we have to keep in mind before we can get to a point where we are recommending GLP-1s for that purpose of reducing cancer risk or a new cancer is that we really need more robust data. Right now, all of these signals and these early data that we have are looking back at people who were prescribed a GLP-1 and saying, okay, let's look at cancer risk and cancer incidence. And generally, these are patients who met the eligibility criteria for a GLP-1, whether that be on the basis of presence of diabetes, based on weight, based on a weight-related condition, things like sleep apnea. Don't know if you don't meet those criteria, are you going to see the same benefit? And we really need that robust research. We need long-term data. We need to know how long should you be on it? Can you come off it, right? These are all things that need to be explored if we're thinking about GLP-1s and cancer risk. And also, these are not benign medications and they do have side effects, and we have to keep that in mind. I think GLP-1s can be remarkably helpful for the right person. I don't think we're at a point where we can prescribe them for everyone who has been diagnosed with cancer or who is at cancer risk, but I think for the right patient, they can be very, very helpful. Let me know your questions and your experiences with GLP-1s.